Asthma is the most common chronic health problem among children, and it's triggered by many factors. One factor might be exposure to air pollutants such as tobacco smoke. Results of two specific reactions. There's a bronchospasm and an inflammation. A non-productive cough accompanied by an expiratory wheezing and shortness of breath. An attack can last minutes to days and may develop into a medical emergency. So, what happens to the airway during the asthma attack? The bronchial tubes begin to spasm, which reduces the amount of air that can pass through them. At the same time, the tissue lining in the bronchioles become inflamed and secrete mucus. Therefore, in an asthma attack, the smaller airways are filling up with mucus and secretions. Then the air is passing through these secretions, and it causes the classic symptoms of asthma, which is wheezing on expiration. A child who experiences symptoms 2 or more times a week should take daily medication to prevent asthma attacks. The child also is prescribed a quick-acting medication or what we call rescue inhaler. This rescue inhaler might be albuterol, and this is for acute relief of bronchospasms or exercise-induced asthma. The inhaler should be readily available at all times because, again, we said earlier that an attack can last minutes to days, but it can develop into a medical emergency where they are unable to breathe. Flu. So the flu is acute, highly contagious, and it is a viral infection of the respiratory tract. It is transmitted by direct contact with moist secretions. With the flu, you can see high fevers and susceptibility to pulmonary complications like pneumonia. What we prescribe for the flu typically is bed rest, increased fluids, and non-aspirin analgesics. And again, the physician would prescribe this. We would be doing the patient education on it. Flu vaccines are now available, and the individual must be vaccinated before the onset of the infection. Now, each year the flu vaccine is developed based on a prediction of what the viral infections they think will be common for the year. The CDC recommends annual flu vaccinations for all healthy children from the ages of 6 months up to the 19th birthday, and also recommends the flu vaccination for their caregivers. So influenza strains continually change, so the child must receive an updated version of the vaccine each year. And this is why, like I said earlier in the slide, they try to figure out what strains and produce the vaccine based on that yearly. Conjunctivitis or pink eye. Pink eye is highly contagious. If you've ever dealt with it, it spreads like wildfire. It is caused by a bacterial or a viral infection. It's important to use good hand sanitization practices and hygiene. Do not share towels or anything that touches the face of an infected child. Make sure to disinfect any articles that may be contaminated, and treat with an antibiotic for at least 24 hours before returning to school or preschool. It's important that health teaching for caregivers of infected children include these suggestions that we just went over so that they can break that chain of infection and that the conjunctivitis can become healed and not just spread throughout the household. Tonsillitis. Tonsillitis is most commonly caused by the strep A bacteria. It causes intense pain with a short time, in addition to fever and general malaise. Again, what's recommended: bed rest, liquid to soft diet, an analgesic throat spray, and oral antibiotics if the causative organism is bacterium. Are there any dangers of tonsillitis? Well, there are, because the danger lies in the secondary problems that can occur, which includes a rheumatic heart disease and kidney disease if the streptococcal infection is not treated with antibiotics. Again, tonsillitis is not always caused by strep A, but it is most commonly caused by strep A. With fifth disease, symptoms begin with a mild fever and general malaise, leading to flushed cheeks and a rash. Children with sickle cell anemia, chronic anemia, or an impaired immune system may become seriously ill when infected, and they will require medical care. Infected pregnant women have an increased risk of miscarriage and possible severe anemia in fetus, so it's also very important that a pregnant woman receive medical care. When outbreaks of fifth disease are more common in the winter and spring, you can get fifth disease any time of year. Fifth disease is spread through direct contact or by breathing in respiratory secretions from an infected person. Hand-foot-mouth disease is caused by the Coxsackie virus, which is ingested and transmitted by direct contact with the nose and throat drainage, saliva, or stool of an infected individual. We will see fever, sore throat, painful red blisters on tongues, mouths, palms, and soles. We also see headache, anorexia, and irritability. And this is why it's called hand, foot, mouth, because the sores typically appear in the mouth, the palms of the hands, also sometimes on the side, near the thumb and the soles of the feet. Most common complication is dehydration with hand, foot, mouth disease. Rest fluids and acetaminophen or ibuprofen for fever or discomfort is typical treatment. To prevent the spread of the disease, family members should be instructed to wash their hands thoroughly, especially after diaper changes, and they should also disinfect any shared items such as toys. Children with hand-foot-mouth disease should be kept out of daycare or school until the fever is gone and the mouth sores have healed. Varicella, also known as the chickenpox, caused by members of the herpesvirus group. It's transmitted by direct or indirect droplets from respiratory tract of an infected person. You will see a slight fever for up to 3 days before the skin eruptions begin. The infection lasts approximately 2 weeks and usually leaves the child with a lifetime immunity for varicella. Varicella virus vaccine, known as Varivax, is available. This is given in 2 doses. Newborns and individuals with impaired immune systems may get very ill or even die from varicella and can cause stillbirths or birth defects in pregnant women. The disease is so contagious in its early stages that an exposed person who is not immune to the virus has a 70 to 80% chance of contracting the disease. The CDC recommends that children receive 2 doses of the vaccine, the first between 12 and 15 months of age, and the second between 4 and 6 years of age. So, what causes shingles? After infection, the virus migrates to a dermatome and may cause shingles or herpes zoster. So after the infection of varicella, the virus migrates and it can cause shingles or herpes zoster. So that's where shingles comes from. Meningitis. Meningitis is an inflammation of membranes that cover the brain and spinal cord. It's caused by a bacterial, fungal, or a viral infection. Bacterial meningitis, sometimes called spinal meningitis, is one of the most serious types. This comes as a sudden onset of fever, headache, neck pain or stiffness, vomiting, and irritability. That's why when anybody, actually not just children, complain of severe neck pain, we are always looking into meningitis. It's treated with immediate hospitalization and IV antibiotic therapy. Meningitis caused by the H. influenzae serotype B, Hib, can be prevented with a Hib vaccine. So that's why they can give a vaccination for that form of meningitis. Viral meningitis usually is mild and it clears up within 10 to 14 days. But fungal meningitis can be quite serious and typically is seen in immunocompromised individuals, such as those with AIDS. Many states require reporting of bacterial meningitis cases to the health department, which probably will recommend preventative antibiotics for potentially exposed person. Hepatitis B can lead to serious chronic infection of the liver. It can be transmitted across the placenta or during birth process if the mother is infected, and it can be transmitted sexually by blood transfusion or by direct contact. A child can carry the virus for years and only later develop liver failure or liver cancer. Many states now include immunizations for HBV, which is hepatitis B, in the recommended immunization schedule, which usually is begun in the newborn nursery. Reyes Syndrome. The cause of Reyes Syndrome is unknown. It's linked to use of aspirin during viral illness in children up to the age of 14. It is acute and sometimes a fatal illness characterized by fatty invasion of the inner organs, especially the liver, and swelling of the brain. This is most often seen in children from infancy through puberty. Prevention is the best treatment. Children up to the age of 14 should never be given aspirin unless prescribed by a physician for a chronic condition. Again, let me repeat that. Children up to the age of 14 should never be given aspirin unless prescribed by a physician for a chronic condition. Autism spectrum disorder. This is impaired, or this causes impaired social interactions. They do not respond to name, avoid eye contact, and show limited interest in their surroundings. Often, the child has very high pain tolerance, but are extremely sensitive to sensory stimulations. The treatment involves educational and behavioral interventions and sometimes medication to treat depression, anxiety, and obsessive-compulsive behaviors. The American Academy of Pediatrics recommends that all children be screened for developmental delays and disabilities during their regular well-child doctor visit at 9, 18, and 24 to 30 months of age. The prevalence of autism spectrum disorders is said to be 1 in 68. It's 5 times more common in boys than girls. The cause of autism is a developmental disorder. It's unknown, but researchers believe it's due to a combination of genetic errors and environmental factors, and perhaps a problem with the fetal brain development. Although many parents are concerned about a connection with vaccines, extensive studies have failed to show the link between the two. And this is a huge debate, and I'm sure in discussion in class, we could spend much time with this information. Cystic fibrosis. The autosomal receives genetic disorder.